Today we're going to be talking about cognitive behavioral therapy for anxiety and anxiety disorders. We'll be talking about how CBT works and why it is so effective for managing anxiety. Hi everyone. There are lots of different types of anxiety and anxiety conditions, from phobias to social anxiety to excessive worry and generalized anxiety disorder, panic disorder, PTSD, OCD. There's lots of different forms of anxiety, and anxiety disorders can take many different versions or forms. So the question is, how do we treat anxiety? How do we make anxiety better? Well, in today's video, I'm going to be talking about cognitive behavioral therapy, or CBT, which is one of the most effective forms of treatment for anxiety and is often considered the gold standard of treatment for anxiety disorders. So we'll be talking about how it works and how to understand CBT for managing anxiety symptoms. But before I get into that, just a couple of disclaimers to go over. I'm a registered psychologist in the province of British Columbia, Canada, and this video is for informational purposes only. It is not intended as a substitute or replacement for advice from your doctor or mental health professional. Now, with those things out of the way, let's start talking about cognitive behavioral therapy for anxiety. Now, chances are you may have heard of cognitive behavioral therapy. It's a very popular form of therapy. A lot of people have heard of it, but they often don't know what cognitive behavioral therapy is or what it looks like. Now, I've done previous videos discussing some of the characteristics and principles of CBT, and so if you're interested in learning more about that or want to know more about that, I'd encourage you to take a look at that previous CBT video. Now, the core model of cognitive behavioral therapy focuses on human experience consisting of three main components: your behaviors, your thoughts, and your emotions. And all three of these are interconnected, kind of like the sides of a triangle. Now, usually when people come to see me, it's because they're experiencing problems with the emotional component of anxiety. They feel scared, they feel frightened, they're anxious about whatever the source of their anxiety is. But anxiety is a lot more than just the emotional state of anxiousness. It's more than the uncomfortable physical and emotional feelings that a person experiences when they're anxious. Now, imagine a scenario in which I'm anxious because I'm worrying about a presentation I have to give. And think about how that would impact my behavior. Now, I may avoid or procrastinate working on the presentation. I may focus on doing other things. I might distract myself by calling up a friend. Well, what impact does that have on how I think about the presentation and think about my level of preparation for it? Well, I might think to myself that I'm not prepared, that I'm now going to run out of time, that this is going to be a total bomb. I'm going to completely embarrass myself. So, if I'm having those types of thoughts, what impact do you think that has on my anxiety? Well, now I'm even more anxious. I'm even more fearful. I'm less confident in my ability to do the presentation. Well, it also works the other way around. Suppose I'm feeling really anxious about the presentation. What am I likely to think about? Well, when people are anxious, if they're worrying a lot, they tend to predict that things are going to turn out badly. So I may get thoughts like, I don't know what I'm doing. What if I stumble over my words? What if I lose track of what I'm saying? What if my throat dries out and I can't talk when I'm presenting? So now I'm imagining all of these negative scenarios and negative outcomes. How's that likely to affect my behavior? Well, I may try to get out of doing the presentation. We know that avoidance is a big behavioral response to anxiety. So I might avoid the presentation. I find a way of getting out of it. Well, what happens to my anxiety the next time I have to give a presentation? Well, I'm going to be more anxious because I didn't do that other presentation. I had to find a way of getting out of it because it was going to turn out so badly. Well, this one's likely to turn out really badly as well. Now, another thing I might try to do, another behavior I might try to engage in this scenario is I might try to over-prepare and make sure that I'm ready for any possible question that might get asked. Now, on the surface, over-preparing seems like a really good idea, but think about the message that I'm giving myself by over-preparing. What am I telling myself if I'm excessively and over-preparing for this presentation? Well, what I'm telling myself is that I don't know what I'm talking about. Because if I did, if I was confident that I knew what I was talking about, if I was confident that I had some expertise to talk about this subject, well then why would I have to over-prepare? So the act of over-preparing is actually undermining my confidence, and it's making the anxiety worse. So you can think of anxiety as a series of ongoing negative spirals and interchanges between what I do and how I think. And those are then going to negatively interfere with how I feel. And they're going to work together to make me progressively feel more anxious. And so the question becomes, well, how do we break this? How do we get out of these negative spirals that are fueling our anxiety? Well, can you control the emotion side of this triangle? Can you just force yourself to relax and not be anxious? Well, no. No one can. If it was possible, we would choose to not feel anxious. And you've probably had well-meaning people in your life tell you things like, oh, just relax or don't worry about it. The problem is, if you could just relax and not worry about it, you would. But the thing is, we don't have direct control over anxiety. But what about the other sides of the triangle? So we may not have control over the emotion part of it, but what about the behavior and the thoughts part of it? Can you control your behavior? Now suppose I asked you to stand up, go to the fridge, and get a glass of milk. Could you do that? Well, yeah, you probably could. You do have some control over your behavior. Now, you may not want to, or you may not feel like getting a glass of milk, but the thing is, you can do that. You do have the control over your behavior. What about thoughts? Now, suppose I asked you to try and think about a situation differently for 5 minutes. Could you do that? Well, it might be a bit more challenging than changing behavior, but what we know is that most people do have some control over changing their thinking and thinking differently about situations. But what if I asked you to not feel anxious for 5 minutes? Can you do that? Well, probably not. Like I said, we don't have direct control over our emotions. And so, you see, that's the formula for how CBT works for anxiety. It's about making behavior change and thought change to indirectly get at changing how you feel, to indirectly get at helping you feel less anxious. Because you can't change your feelings, you can't change the anxiety directly, but you can change what you're doing, and you can change how you're thinking, and that indirectly improves how you feel. And that's been the recipe for all of the videos I've done for how to manage anxiety disorders. So I've done videos on intolerance of uncertainty experiments in generalized anxiety disorder, videos on exposure and response prevention in OCD, videos on prolonged imaginal exposure and behavioral exposures in PTSD, videos on safety behavior experiments in social anxiety. These are all about changing behavior and changing thinking patterns to reduce anxiety. It's all about breaking that anxiety behavior thought spiral. And so I hope that gives you a bit of background on how CBT works in anxiety and how you can use cognitive behavioral therapy approaches to break the negative spirals that keep anxiety going. So I hope that makes sense. I'd love to hear your thoughts or ideas or questions about this, so please leave me some comments in the comments section down below. If you've been enjoying my videos and would like to see more, please hit that subscribe button and notification bell, and you'll be alerted every week when I post a new video. So that's all for today's video. As always, thank you for making it all the way to the end of this video, and I will see you in the next one.